What is skin to skin care? Regulating the baby's normal environment inside, which means it controls the heart rate, it controls the breathing, it helps the baby transition to normal blood glucose levels. All of these things are well established. Helps the baby to improve their immunity and sort of fight infections faster in contact with the mother's skin, and so she is able to breastfeed. It helps improve the neurodevelopmental outcome in a lot of babies. Is only a mother allowed to do that? Not really. Anybody can do that. A caregiver, it can be a grandparent, a father. In fact, studies have shown that when father do this, they actually bond with the babies better. Hello, I am Dr. Lakshmi. I am a consultant pediatrician and neonatologist in Cloudnine, Bellandur, Bangalore. Today I am here to tell you about an interesting concept. It's called skin to skin care. And what does it mean? It means as simple as putting the baby on bare skin. It's not a new concept. It's not something that has just come up. It has been in practice for the last 10 years. Of late, we have discovered that it has huge benefits for the newborn. Now imagine this, the newborn has been swimming for 9 months in the warm mother's womb, bathed in warm fluid, and suddenly and very rudely, I must say, the baby is delivered outside. And now the baby has to maintain their temperature, they have to fend for themselves in terms of nutrition. It's a very rude shock. And so what can be more better than putting the baby on the mother's chest? And it's as simple as that. The baby instantly calms down, absorbs the temperature from the mother's chest, and seems to adjust more seamlessly to the environment outside. How is it done? Skin to skin care, and can only mothers do it? No, it can actually be practiced by any family member or the caregiver of the baby, and the mother usually is the preferred person because there are a lot of benefits to the mother that happens when the newborn is on the mother's chest. But it can be a father, it can be a grandparent, it can be an aunt, whoever is available we are more than happy to accommodate them. Now, what does it mean? How is it done? It is actually done by placing the bare baby on the bare skin of the caregiver. So we usually have the baby placed in a frog-like position on the mother's chest, and then a warm blanket is wrapped around the mother and the baby as a single unit. Could be the father as well or any other caregiver. I'm using mother this as a term just to mention the person who may be doing it. So here the mother and the baby are in one unit, and how long do they stay in this contact? It can be up to the comfort of the caregiver. It can be half an hour, it can be up to 3 to 6 hours. So we prefer that babies who are sick and are in the NICU, or that is the neonatal intensive care unit, we want the mother and the baby or the caregiver and the baby to be in this position for up to 3 to 4 hours. There are a lot of benefits which I will shortly discuss about the benefits of skin to skin care. Now, the skin to skin care, the major benefits of this has been found by a lot of science-backed studies. We've had reports come in from WHO, we've had reports from esteemed scientific pediatric bodies which have told us that the chances of recovery and a faster discharge is almost 2 to 3 times faster when the skin to skin care contact is initiated right from the word go. 40% children babies actually transition very well to the normal environment faster when we see this skin to skin care contact happening. It is a simple technique. It's not complicated. It doesn't require any gadgets, and that is where the advantage is. Now, what are the other advantages that the science has discovered is, first and foremost, as we very well understand, that it regulates the baby's heart rate, breathing, even the glucose. All these things get regulated faster when the baby is in contact with the mother's skin. What is the second most important benefit? To the mother, when the baby is on the mother's chest, there is a letdown of a hormone called oxytocin, and this oxytocin helps her in establishing and initiating breastfeeding much faster. Sometimes when babies have a problem called as nipple confusion, that also gets sorted when the baby is on the mother's chest for at least 20 to 30 minutes. It resets this mechanism. How wonderful is this? I mean, that is the advantage of a simple technique like this. The third most advantageous thing that we see is that it helps to develop or rather regulate the neurobehavioral outcome in the long run. So it helps improve cognition, it helps reduce the stress level hormones, which is called as cortisol in the baby, and the transitioning to the normal extrauterine life is much more seamless and faster. And on top of all of this, it helps with the bonding part. The fourth most important and a little unusual perhaps for you to understand would be that when the baby is on the mother's skin bacteria, which we call as commensals, these are harmless bacteria, help colonize the baby's skin as well. It helps improve the baby's immunity, and it also causes them to help fight infections in a more organic manner. This is especially important when it comes to babies delivered by cesarean section, because versus the normal delivery which would have happened vaginally, the cesarean section babies always have a disadvantage that they do not have good bacteria colonizing them. So these are some of the advantages that I've enumerated. In fact, in NICU and preterm babies, we encourage the caregivers to keep coming multiple times in the day. Here at Cloudnine, this is a practice that is very strongly followed. And what do we hope to achieve? Even when they are sort of upset and serious, the baby may be in a slightly more serious condition as well. Even then, this KMC, this is also part of what we call as kangaroo's mother care. And the name is self-explanatory here. That is kangaroo, the baby in the pouch. Similarly, the baby goes onto the caregiver's skin. As far as fathers go, this also helps them to bond with the baby. This helps, in fact, reduce a concept known as paternal depression, which sometimes happens post a baby is born. So the bonding part is so much more better for them. It gives a mother a break because of the constant stress she's under when the newborn is in the NICU. So it's a simple concept. It's not complicated. It doesn't require gadgets. It just requires your warmth, your presence, and a little bit of time from you. So please do practice this, and if not, please do ask your pediatrician or doctor about this. I'm sure they will be able to tell you that this is a very doable concept. Of course, you can do skin-to-skin contact after a C-section. In fact, we encourage all babies to have the skin-to-skin contact right after they are born. It can be even a small preterm baby, it can be a full-term baby, it can be a C-section baby, it can be an instrumental delivery baby, anything. All babies can have skin-to-skin contact absolutely safely, no questions. If the baby is in NICU, we ensure that the baby is absolutely paramount is the baby's safety first. Second, when the baby is stable, even if the baby is having a lot of tubes running, even if the baby is having a lot of gadgets attached to it, we ensure that without dislodgement of any of the devices attached, the baby can have skin-to-skin care contact safely. The recommended time actually for NICU babies is almost 3 to 6 hours. Can you imagine that? The caregiver can spend that much time with the baby absolutely safely, and it actually helps them to discharge faster and they stabilize much more seamlessly. Well, it's recommended that skin-to-skin care contact is done for all babies till they are discharged from the hospital, and even beyond. When at home, up to 3 months, it's absolutely fine. Some of the preemie babies enjoy skin-to-skin contact up to 6 to 9 months as well, but that is left to the caregiver's discretion. But for sure, while in the hospital, especially for a sick baby, we encourage every single day skin-to-skin care contact. And till the baby grows to term, this is a preferred method for them to transition better. For any more questions or clarifications, please subscribe to our YouTube channel at Cloudnine Care. We are happy to answer all your questions. Thank you.